Hello, everybody. This is Nathan Pacheco. Thank you for watching my undergraduate research presentation of my thesis, Nature or Nurture, the Relationship Between Self-Care, Personality Traits, and Burnout in Critical Care Healthcare Professionals. The purpose of this study was to fill a gap in the burnout literature. This is the first study to correlate self-care practices and personality characteristics to burnout within a single critical care health professional cohort in the United States. Burnout syndrome is a state of emotional and physical exhaustion. Maslow divides burnout into three dimensions: emotional exhaustion, depersonalization, and decreased personal accomplishment. Previous investigations of burnout syndrome have found that several personality traits under the five-factor model frequently correlate with burnout syndrome. Conscientiousness, extroversion, and agreeableness are negatively associated with burnout, while neuroticism is almost invariably positively associated with burnout and emotional exhaustion. Recently, healthcare professionals are attesting to the efficacy of self-care as a mechanism to reduce burnout, and we use the Denier Self-Care Practice Inventory 90 to measure self-care practice because of its comprehensiveness in measuring self-care. It measures nutrition, sleep, socialization, and productivity. To measure personality, we use the mini IPIP, which is a 20-item instrument, and we use these instruments to mitigate surveyor fatigue of taking long surveys. The reason we use critical care as our population is because critical care professionals are predisposed to burnout. The environment intrinsic to critical care is extremely stressful due to patient mortality, ethical dilemmas, traumatic events, and strenuous daily work routines. It's estimated that the prevalence of burnout in critical care is upwards to 50%. The reason it's important to study burnout syndrome is because burnout leads to turnover, and as it is, we already are projected a nurse shortage by 2020. And that's come to fruition here today with COVID and more generally, even before COVID. Another reason that we need to study burnout is because turnover is expensive for healthcare. Burnout leads to worse patient outcomes, and burnout is associated with diabetes, high cholesterol, insomnia, and depression. The results of our study found that self-care mitigated burnout syndrome, and neuroticism and agreeableness were significantly positive related to burnout. What this means for practice: it means that we need more information to discern which personality traits truly predispose someone to burnout. Previous literature suggested that agreeableness is a protective factor, but this study found that agreeableness was most significantly correlated with burnout syndrome. Furthermore, self-care, although is not correlated as significantly or highly with burnout as personality traits, was consistently a factor that reduced burnout syndrome in these critical care professionals. Finally, we found that burnout syndrome is moderate in these professionals and was found in almost 1 in 4 professionals at 23%.